My name is Amanda Jelinek, and this is my abdominal video. I'm starting by scanning the room. Can you go ahead and scoot over here? Alright. Before entering my patient's room, I would check the chart and make sure I have the correct orders and correct patient. Once I enter the room, I would provide privacy and introduce myself. And then I would perform hand hygiene. Hello, Mr. Prez. My name is Amanda. I'll be your nurse today. Can you go ahead and tell me your full name and date of birth?
Marco Perez, 7988.
Alright, and what brings you in today?
Just a checkup.
Alright, and are you in any pain today?
No.
No? Are you on any medications?
No.
Do you have any allergies?
No.
Okay. I'm going to go ahead and do an abdominal assessment and a musculoskeletal assessment as well. How is your appetite? Do you have like a normal diet? How many meals would you eat a day? 2 meals? Okay. Do you snack a lot? Alright. Have you noticed any changes in your appetite? Any increase of appetite or loss of appetite? Do you try and eat vegetables and fruit? Okay. How is your urination when you pee? Do you pee normal? Have you noticed like a frequency in it at all? Any burning when you pee? Any blood in your pee? And how is your bowel movements? When's the last time you had a bowel movement? Earlier today? Okay. Do you have a regular schedule? When you have a bowel movement, how would you say it looks? Like what color?
Brown.
Brown. And would you describe it as soft or hard or loose?
Soft.
Soft, okay. Alright. And are you sexually active? Yes. And how many partners do you have? One. Okay. And are you do you practice safe sex? Okay. Alright, I'm gonna go ahead and start by having you remove your shirt, and I'm gonna have you lay down and start doing your abdominal assessment.
What?
Just lay down on the couch. Alright. Okay. Looking at my patient, his skin color is true to ethnicity. There's no signs of any scars or marks on any bruising on him. He is warm to touch and dry. I'm going to go ahead and start by listening to his stomach for bowel sounds using the diaphragm of my stethoscope. I'm going to start in the right lower quadrant. This might be a little cold. Move up to the right upper quadrant. And over to the left upper quadrant. and the vowel sounds were normal. There was no sign of any hyperactive vowel sound. I'm now going to percuss in the same area in the same way, starting in the right lower quadrant. Moving up to the right upper quadrant. Noting the dullness that was in the right upper quadrant where his liver is. Moving over to the left upper quadrant. To the lower left quadrant. And the sounds were tympanic. Now I'm going to go ahead and palpate his abdomen. I'm only going to do light for the comfort, for my patient's comfort level. But in other cases, I could do deep palpation. I would ask my patient if they are in any pain, which I did earlier, and he said he was not. If he was, I would just go to that location last. And I was in the right lower quadrant, I'm going to move up to the right upper quadrant. I'm just feeling for any masses or bulging. Go over to the left upper quadrant. To the lower left quadrant. And there were no signs of any masses or bulging anywhere. I did forget to note that looking at the patient's abdomen, it is symmetric. His umbilicus is midline. I didn't see any signs of any distended veins or pulsations. I am now going to go ahead and listen to his arteries using the bow side of my stethoscope. I'm going to start and listen to the aortic. And move over to listen to the renal. And then I'm going to go down and listen to the iliac artery. And I did not hear any sounds of bruits or any adventitious sounds. Now I'm going to go ahead and have you sit up. Can you sit back up? And right here. See if I can get this to get you. Okay, I'm going to have you lift your foot up. I'm going to do a Babinski test. And we're going to do that one more time. And there was no reaction, so that the Babinski test was negative, which is a normal sign. If it was positive, it could be a neurological disorder, possibly.
Yes.
And I can do the other one, too. And no reaction again. Now I'm going to have my patient walk. So I'm going to have you just stand up and walk to the wall and back. I'm going to watch his gait. Yep, and just turn around and walk back. I'm noting that my patient's gait is steady, and you can go ahead and stand right there. I'm also going to have you stand straight and have you close your eyes and put your arms out. And can you touch your nose with your finger one at a time? Alright, thank you. And while you're standing there, I'm also going to have you do a heel to, you put your arms down, and have you do it, put your heel onto your opposite shin and go down. Hold on, let me make sure the cameras can see. And the next one. Okay. Alright. And you can go ahead and sit back down. And my patient did not show any signs of any swaying. He had a steady gait the whole time. His posture was fine. Now I just have a couple more questions. Have you had any issues with your joints, any joint pain or swelling?
No.
No? Have you had any limit of your range of motion at all? No. No, okay. I'm just going to feel on your joints, starting with your elbows and wrist. I'm doing both so I can feel just for any swelling. I'm going to do the knees as well and ankles. Just feeling for any signs of swelling, which I do not feel. I'm sorry, I do have to have you stand up one more time. I have to have you do a couple range of motion. So if you want to move right over, back over here. Alright, and if you could go ahead and take your leg and move it out. Take your leg and move it out away from your body. Yep. And that's abduction, and go ahead and he brought it back in, was adduction. Can you go ahead and turn your foot outward away from your body? And that's eversion, and put it back in. Inversion. And can you go ahead and go like this? It's rotation of his neck. And I'm going to have you put your arm around like this. Doing circumduction. My patient seems to have full range of motion and no difficulty while doing any of those. Now I'm going to have you grip my fingers. And can you push on my hands? And pull on my hands. And I'm going to have you sit back down and test your feet the same way. Put your foot up and push on my hand. With the other one too, if you don't mind. Okay, and then I'm going to have you push back. And I'm going to have you raise your legs. And my patient's strength was strong, normal, there no signs of any weakness. After doing this assessment, I would make sure to do all my documentation on anything I found and notify the doctor. Thank you.